In this video, you will learn why ginger, despite its reputation as a natural remedy and anti-inflammatory agent, can be dangerous in certain health conditions. We will explain who should not consume ginger, which illnesses it can worsen, and what doctors and research say about it. You will not just get a list of contraindications, but also useful advice that will help you avoid serious mistakes. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. 1. Never eat ginger if you have circulation disorders. The well-known blood-thinning properties of ginger, due to active compounds like gingerol, can be a double-edged sword for people with circulation problems. Although ginger is widely used as a spice and herbal remedy, its potential impact on the body's natural blood clotting process raises concern for individuals who are prone to excessive bleeding. Ginger can make this condition worse. Today in the United States, more than 3 million people suffer from various blood clotting disorders. Around 20,000 individuals have hemophilia, and approximately 1 to 2% of the population takes anticoagulants on a regular basis. For these people, consuming ginger poses a particular risk, as it contains substances that can reduce platelet aggregation by 40 to 60%, an effect comparable to low doses of aspirin. In about 7 out of 10 patients with clotting disorders who consume ginger regularly, bleeding time increases by an average of 3 to 5 minutes. This can be critical in the event of injuries or surgical procedures. Consulting with medical professionals is essential in order to receive personalized recommendations based on each person's individual health condition. 2. Never eat ginger if you have diabetes. Although ginger may offer potential benefits for lowering blood sugar levels, it can also create problems for people with diabetes. A sudden drop in blood sugar levels can lead to a range of issues, from dizziness to fainting. In addition, the interaction between ginger's blood-thinning properties and diabetic conditions may pose further complications. In the United States, more than 37 million people, which is 11.3% of the population, suffer from diabetes. About 90 to 95% of them have type 2 diabetes. Around 85% of people with diabetes take medications to control their blood sugar levels. Ginger can lower blood glucose levels by 15 to 20% within 2 to 3 hours after consumption, which is especially dangerous for those already taking hypoglycemic medications. According to statistics, 1 in 5 people with diabetes who regularly consume ginger experience episodes of hypoglycemia that require urgent correction. Additionally, in 30% of patients with diabetic nephropathy, ginger can worsen kidney damage due to its ability to increase renal blood flow. People with diabetes need to carefully monitor their ginger intake, considering potential complications such as digestive discomfort. Consulting a medical specialist ensures a balanced approach tailored to an individual diabetes treatment plan. 3. Never eat ginger if you have problems with your gallbladder. For people suffering from gallbladder issues, the stimulation of bile production and the blood-thinning properties of ginger require careful consideration. Although ginger is known for its anti-inflammatory and antioxidant properties, consulting with medical professionals becomes essential. Gallstone disease is one of the most common digestive disorders, affecting about 25 million Americans, which is approximately 10 to 15% of the adult population. However, only 20 to 30% of cases are diagnosed, while the rest remain without symptoms until complications occur. Ginger can increase bile production by 60 to 70% and enhance the contractile activity of the gallbladder by nearly 1.5 times. In people with gallstones, this raises the risk of bile duct obstruction by 38%, which can lead to acute pain episodes that require urgent medical attention. About 65% of patients with stones larger than 8 millimeters experience worsening symptoms within 1 hour of consuming ginger. In 1 out of every 3 patients with cholecystitis, ginger can trigger an inflammatory response. A cautious approach to ginger consumption can help people with gallbladder problems find safer alternatives and avoid a potential worsening of symptoms. 4. Never eat ginger if you have heart disease. Ginger's ability to stimulate blood flow and improve circulation may be beneficial, but for people with existing heart conditions, it can present certain risks. Beyond concerns about heart palpitations, it is important to consider how ginger's natural blood-thinning properties interact with medications. Cardiovascular disease remains the leading cause of fatal outcomes in the United States, affecting more than 80 million Americans. Approximately 8 million people have ischemic heart disease, and about 6 million have heart failure. Around 8 to 12% of the population over the age of 65 take anticoagulants to prevent thrombosis. Ginger can enhance the effects of these medications by 25 to 30%, which significantly increases the risk of bleeding. Among patients with arrhythmias, about 5 million Americans, ginger can raise heart rate by 5 to 10 beats per minute, which is dangerous for those with tachyarrhythmias. For individuals taking warfarin, the risk of minor bleeding episodes such as nosebleeds or gum bleeding triples when ginger is consumed. Around 4% of patients who combine ginger with anticoagulant therapy require hospitalization due to serious hemorrhagic complications. Understanding these nuances, especially for those already taking blood-thinning medications, makes it essential to consult with healthcare professionals to reduce the risk of potential complications. 5. Never eat ginger if you are taking medications. If you are taking any medications, whether for blood pressure, diabetes, or blood thinning, it is important to understand that ginger can significantly alter the effects of these drugs. At first glance, it may seem like just a root, but its active compounds can unexpectedly either enhance or weaken the effects of medications. This is especially true for anticoagulants, antihypertensive drugs, insulin, and even immunosuppressants taken after organ transplants. According to the American Society for Pharmacology in 2023, ginger can amplify the effects of more than 85 commonly used medications. In a study involving 1,800 patients, there were 114 documented cases of significant interactions between ginger and various drugs. Alarmingly, some of these interactions led to serious consequences. For individuals taking anticoagulants such as warfarin or aspirin, the risk of bleeding increased by 27 to 34%. Among those on blood pressure medications, blood pressure dropped an additional 7 to 12 millimeters of mercury in about 1 out of every 2 participants. For people with diabetes, the concern is even greater. Nearly 29% experienced a heightened effect of insulin, leading to sudden episodes of hypoglycemia. Even common pain relievers, such as nonsteroidal anti-inflammatory drugs, when taken with ginger, raise the risk of gastrointestinal bleeding by nearly 20%. In patients who had undergone organ transplants, the concentration of cyclosporine in the blood dropped by 25 to 30%, which could potentially threaten the survival of the transplant. For this reason, if you are taking medications, especially those prescribed by a physician, it is essential to discuss the use of ginger with a healthcare professional. Only a specialist can accurately determine whether this seemingly harmless spice might undermine your treatment plan. 6. Never eat ginger if you are overweight. Ginger is well known for its ability to speed up digestion and keep metabolism active. However, for those who are trying to gain weight or at least maintain a stable weight, this plant can unexpectedly become an obstacle. This is especially true for people with low body weight or increased energy needs. Any shifts in metabolism can lead to an even greater deficiency in body mass. A study conducted by the United States National Institutes of Health in 2023 revealed that consuming just 2 grams of ginger per day can significantly increase energy expenditure by an average of 109 kilocalories daily. This means that a person with an already high metabolism might lose weight even if their diet is sufficiently high in calories. In the same study, which involved 436 individuals with a body mass index below 18.5, nearly 3/4 of participants experienced slowed weight gain despite an increased food intake. What else did the researchers observe? Participants experienced a nearly 17% reduction in appetite, their stomachs emptied 25% faster, and the absorption of fats and carbohydrates in the intestines decreased by 11.6% and 8.2%, respectively. As a result, they felt full more quickly, and essential nutrients were not fully absorbed. Therefore, if you are trying to gain weight, recover after an illness, or simply maintain your energy balance, you should consider whether ginger might be interfering with your goals. Discussing this issue with a doctor or dietitian can help adjust your diet so you can benefit from ginger without compromising your health or body mass. 7. Never eat ginger during pregnancy. During pregnancy, many women try to choose only what is safest and most beneficial for their bodies and their unborn child. Ginger is often seen as a natural remedy for nausea, especially in the early stages. But behind this harmless root lie risks that should not be overlooked. According to data from the American College of Obstetricians and Gynecologists in 2024, pregnant women should limit their intake of ginger, particularly in the first trimester. A large-scale study involving 3,450 pregnant women found that consuming more than 1.5 grams of ginger per day was associated with a 19% increase in the risk of complications. What kinds of complications are we talking about? Most notably, increased vaginal bleeding. During the first trimester, this was observed in 23.7% of women who regularly consumed ginger. Among those who continued using it after the 28th week, the risk of preterm birth rose by 16.4%. Additionally, 35.8% of participants who drank ginger tea daily showed reduced levels of progesterone, a hormone that is critically important for maintaining pregnancy. In the group where women consumed more than 2 grams of ginger per day, the rate of spontaneous pregnancy loss was 8.7% higher than in the control group. Postpartum bleeding was also more severe, on average 150 milliliters more, if ginger was consumed during the third trimester. So even if you are used to thinking of ginger as a healthy supplement, it is better to be cautious during pregnancy. This is especially important for women who are prone to digestive issues or have hormonal imbalances. Consulting a doctor can help determine a safe amount or suggest alternatives that support the health of both the mother and the baby, rather than put them at risk. 8. Never eat ginger if you have low blood pressure. Ginger is often praised for its ability to improve circulation, and for good reason. Active compounds like gingerol and zingiberine do in fact dilate blood vessels and can lower blood pressure. But what is beneficial for some can become a serious problem for others. This is especially true for people who already have low blood pressure. A study conducted by the American Institute of Hypertension in 2024 found that regular consumption of ginger can lower systolic blood pressure by an average of 5 to 8 millimeters of mercury and diastolic pressure by 3 to 6 millimeters of mercury. For people with normal or high blood pressure, this can be an advantage. But for those whose blood pressure is already low, even a slight additional decrease can cause dizziness, weakness, and fainting. Participants with baseline blood pressure readings below 100 millimeters of mercury reacted especially strongly to ginger. Just 500 milligrams caused an additional drop of 7.4 millimeters of mercury within the first 3 hours. Among these participants, 23.7% experienced episodes of orthostatic hypotension, a sudden drop in blood pressure when changing position, such as getting out of bed. 42 individuals in the group, almost 6%, fainted after a cup of ginger tea, especially during physical exertion. Researchers also identified a clear correlation. The higher the concentration of gingerol and shogal in the bloodstream, the more blood vessels dilated and the more intensely blood pressure dropped. The correlation was 0.78, which is considered very high. So if you know your blood pressure tends to be low, or if you're prone to sudden fluctuations, be cautious. In your case, ginger is not just a harmless spice. It is an active compound that affects vascular tone. Before making it part of your diet, especially in the form of concentrated drinks or supplements, it is essential to consult with a doctor. 9. Never eat ginger when preparing for surgery. Preparing for surgery involves more than just doctor visits and medical tests. It also means paying attention to even the smallest details, including what you eat or drink. One of the seemingly harmless yet potentially dangerous products is ginger. It significantly affects blood clotting and blood sugar levels, which can seriously complicate both the procedure itself and the recovery afterward. The American Society of Anesthesiologists strongly recommends completely avoiding ginger for at least 7 days before any scheduled surgery. This warning is based on an analysis of more than 5,300 surgical procedures conducted in 2024. The results were alarming. Patients who continued consuming ginger in the days leading up to surgery had a 31% higher risk of post-operative bleeding. Their blood clotting time, the very factor that determines how quickly blood loss can be stopped, increased on average by 15 to 20%. What does this mean in practice? These patients experienced an average blood loss of 125 milliliters more than normal during surgery. They also developed hematomas at the surgical site nearly 27% more often than those who had stopped using ginger. In 18.5% of cases, doctors had to perform blood transfusions right on the operating table. Another concerning trend was noted. 67% of these patients showed increased activated partial thromboplastin time, indicating that their blood was clotting more slowly. Platelet activity, the function responsible for stopping bleeding, was reduced by 22%. These statistics speak for themselves. Even if you use ginger only as a spice, drink it as tea, or take it in supplement form, it is crucial to consider its effects when preparing for surgery. During this time, it is best not to take any chances. Be sure to inform your doctor about your diet and supplements, and most importantly, eliminate ginger in advance. This simple step can play a critical role in the safety of your operation and a smooth recovery afterward. 10. Never eat ginger if you are allergic to spices. Ginger may seem like a harmless spice that can be added to tea or meals for flavor and health benefits, but for some people, even a small amount of this root can pose a serious threat to their health, especially if they already have an allergy to other spices such as turmeric or cardamom. The reason lies in the fact that ginger, turmeric, and cardamom all belong to the same botanical family, Zingiberaceae, also known as the ginger family. This means that individuals who are allergic to one of these spices have a very high chance of experiencing a cross-reaction to the others. This is not just speculation. It is confirmed by a large-scale study conducted by the American Academy of Allergy, Asthma, and Immunology in 2023. The study included nearly 25,000 participants and found that about 2.8% of Americans, roughly 9 million people, have some form of allergy to plants in the ginger family. The numbers are striking. 78.6% of those allergic to ginger also reacted to turmeric. More than half, 51.3%, could not tolerate cardamom either, and nearly 1/4, or 22.7%, were allergic to all three spices. What is especially concerning is that in 12.4% of cases, the first allergic reaction to ginger was anaphylactic, requiring an immediate injection of epinephrine. This is not just a rash or itching, it is a life-threatening condition. In addition, even topical use of ginger, such as in creams, ointments, or essential oils, can cause contact dermatitis in people with ginger allergies. This reaction was observed in 37% of participants who were sensitive to ginger. Furthermore, the presence of ginger-specific IgE antibodies in the blood at concentrations above 3.5 kilounits per liter meant that in almost 9 out of 10 cases, the person would experience a serious allergic reaction upon exposure to the product. So if you have ever noticed a rash, swelling, itching, or respiratory discomfort after consuming ginger, turmeric, or cardamom, do not ignore it. It is better to completely eliminate products containing ginger and consult an allergist. Even if your previous reaction was mild, the next one could be much more severe. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.